Hello, my name is Kristen Deary, and my presentation is on the struggles of conceiving for my human sexuality class, Psychology 100 101, Professor Laura Sanchez. Why I chose to talk about the struggles of conceiving. First, I wanted to talk about the struggles of conceiving because I was actually somebody who struggled myself. It took more than a year and a half for my husband and I to become pregnant, and that was without any infertility treatment, thank goodness. However, none of my friends or anybody that I knew really understood our struggle or my constant disappointment of when I would get negative tests that would come back. Um, the second reason I wanted to discuss the struggles of conceiving is because I do work for a fertility clinic at Palo Alto Medical Foundation. I see the struggles of my patients and what they go through firsthand every single day for the last 3 years. And I wanted to share my knowledge of my field and let others know that they are not alone. Did you know that about 1 in 8 or 7.4 million women of reproductive age have received help for infertility in their lifetime? And 12% of married women have trouble getting pregnant or sustaining pregnancy. Male infertility issues also contribute up to nearly 40% of infertility cases. So, what is infertility? According to the American Society for Reproductive Medicine, infertility is the result of a disease of the male or female reproductive tract which prevents the conception of a child or the ability to carry a pregnancy to delivery. A patient will be diagnosed with infertility if they have been trying to conceive for at least a year or more. Some of the common female infertility diagnoses that I've seen in infertility are diminished ovarian reserve. So they have a very severely diminished egg reserve. This can even come at very young ages. I've seen a patient as young as 19 who essentially is like early menopause. She had no eggs, and it was really heartbreaking to see that. Some of the other diagnoses include endocrine hormonal issues, complications from STIs, like prolonging chlamydia without treatment can cause scarring. There is genetic issues, so family history of genetic issues or genetic problem with the embryos when they, or with the babies when they do get pregnant. They could have continual pregnancy losses because there's something genetically wrong with the pregnancies that they have. Anovulation is lack of ovulation, so they're not ovulating an egg each month. Polyps, fibroids, and endometriosis are all conditions of the uterus, something typically in the uterine cavity that if an embryo were to land on one of those, it can create a problem because if an embryo were to land on, say, a polyp, that might not be a suitable place for a pregnancy to grow, so ending up in a miscarriage. There is many diagnoses of infertility. However, one of the doctors that I did talk to, she did explain the most common diagnosis for both actually male and female is unexplained infertility, meaning we have no diagnosis. We do not know why they are not able to conceive. Common male infertility diagnoses, they include sperm disorders, so motility, morphology, some of those issues, sperm count, structural problems, meaning that they could maybe have something structurally in their male reproductive system that is not correct. There could be some sort of structure issues preventing them, maybe even for like the sperm to connect with the semen when they ejaculate. Ejaculation, I think, is lack of ejaculation. They're not able to ejaculate. They also include genetic disorders as well, hormonal disorders, and like I said, unexplained male infertility as well. So most infertility treatments, there's kind of quite a few depending upon what you're doing. However, I would say most patients start off with either like a timed intercourse or intrauterine insemination. And I should mention that insurances also rarely cover IVF treatment right off the bat. They usually want you to do a certain number of timed intercourse or, say, intrauterine inseminations before they will say, okay, you failed these treatments, therefore we now have to proceed to IVF. Timed intercourse is just as it sounds. A patient will time unprotected intercourse with their partner's ovulation period. Timed intercourse can be a natural cycle, meaning without any medications, or a medicated cycle using medication like Clomid or letrozole to stimulate the ovaries into producing an egg. Intrauterine insemination, IUI treatment is usually performed during an ovulation cycle. Most women take medication, again, the Clomid or letrozole, to help stimulate the ovaries. During an IUI, we will basically do a sperm wash, what's called a sperm wash, to basically separate all the bad sperm from the good sperm. Basically, the moving sperm is what we want to see as the total motile sperm. So we'll do the sperm wash, and then in the exam room, the physician will insert a speculum, draw up the specimen, the sperm, into a small catheter. And then the doctor will then insert that small catheter and pass it through the cervix and will inject the full amount directly into the uterus. This is an excellent treatment due to its lower costs compared to IVF and is commonly used for same-sex couples, typically using like frozen donor sperm. IVF treatment is much more costly compared to IUIs and can cost couples up to $50,000 per treatment cycle. This is quite costly, especially when you have patients who may not be able to afford this due to kind of even demographic reasons. IVF basically helps with fertilization, embryo development, and implantation so you can get pregnant. You first start off by taking stimulating medications to mature the antral follicles. Once mature, the doctor will take the patients into the surgery center and do the egg retrieval. At the egg retrieval, sometimes the patients choose to do a fresh transfer where the embryologist will inseminate the egg with the partners or using a donor sperm that will be implanted back into the uterus. Or sometimes due to certain reasons like ovarian hyperstimulation or genetic testing, they'll do egg freezing or create embryos and then freeze them. Um, uh, Um, and usually the embryos are sometimes created to do like a 3-day or 5-day blastocyst. If eggs were frozen, embryos created, or genetic testing was done, then a patient will go back for a cycle that primes the uterine lining to thicken and get ready to transfer that embryo. Patients doing IVF treatment have the option to genetically test the embryos to make sure there is no genetic problems that will arise either during pregnancy or after the baby is born. And we also have an egg donor program that allows us to assist patients who may not have a good egg quality or have severely diminished ovarian reserve, like I had mentioned earlier. Patients can also use surrogates when they absolutely cannot carry a pregnancy due to medical reasons. And same-sex couples often use surrogates as well. However, I would say a lot of female same-sex couples do often choose to use their own eggs and then do a frozen donor using frozen donor sperm for IUIs. And here I included some pictures of what in vitro fertilization would kind of look like kind of through the steps there. And then kind of just an example of an egg donor on how that happens, where you have the husband and wife, where you're still using the husband's sperm, but maybe using a donor egg to create that embryo. Surrogacy, I have included some photos here who the intended parents are and gestational carriers. But there's also, traditional, there's different types of surrogacy, like traditional and gestational. And you can kind of see on the graph there um, who uses what. So traditional surrogacy uses intended mother is using donor eggs and the surrogate, and then gestational carrier, the intended mother is using her own eggs and is the gestational carrier using her own eggs. Some of the things I did not mention actually that I had forgotten to mention in my paper is some cultural aspects of fertility treatment. I did want to note that some cultures do not have sexual intercourse at all. It could be due to their culture and their religion. Religious systems do, happen to affect them being able to have intercourse, as well as the religious systems also prevent patients from doing certain fertility treatments. Some patients' religions allow them to do IUI but not IVF because their belief system doesn't believe in the way that IVF fertility treatment is done. Some women also experience very painful intercourse. A lot of patients that we see have problems like vaginismus, and they aren't able to have pleasurable sexual intercourse with their partners, so therefore they come to us for treatment, and then also help them to get pregnant. Same-sex couples also, like I said, need assistance to become pregnant. So we do have surrogacy, IUI, and IVF options available to same-sex couples as well. So in conclusion, kind of the main thing, that I had wanted to basically state is that um, millions of people suffer from infertility and they're not alone. There are so many people going through infertility treatment, and it's a journey, it's a process. Anybody that you talk to who goes through infertility treatment has had their struggles. So like I said in my paper that, these couples, you know, do suffer from infertility, but because of all the medical technologies and fertility treatments that we have now, these treatments have successfully increased majorly those chances for those patients who struggle with infertilities. Um, a lot of infertility, diagnoses can be treated with surgery. If it's endometriosis, polyps, fibroids, if they have like septums or anything kind of structurally going on as well. You can see here for CNY Fertility is another fertility clinic. And I have put here kind of like the overall success rates. So if you just look at the overall success rates, it's pretty successful, even though it is an expensive treatment and patients are kind of paying per chance. The success rates are really worth the treatment. So even though patients go through all these troubles, the success rates say that they are able to become parents, and That's the main thing with infertility is that we want to always help patients become parents. And that was